Welcome to the office.
Do you remember what you came for the first day you came to my office for? Your back was hurting?
Tailbone.
Your tailbone, remember? So you were referred by another friend who was a dancer, and when you were doing your back bends, remember you were doing back bends and then coming out it was hurting, right?
Yeah.
So today we're just going to go over the visit and show kind of what we do for you, okay? We're going to start with the exam. Now Anya is a high competitive dancer. She's very active, she's a natural, and she has some skills. She's got some good skills. So these back bends that she was doing, for whatever reason, it actually threw out her S3, S4, way down low in the sacrum. Now what's interesting with the sacrum starts off as 5 segments, 5 tubercles, and they ossify by around age 32, 33. So in the child, the sacrum, the individual segments, when they go out, can produce nerve pressure, right? And in Anya's case, it was related to her highly competitive dancing. She adjusts very well. We then started working on your knees and your ankles, right?
Mm-hmm.
We're going to start with scoping and see what we find with her. Got a little bit of pressure here. C4 on the right. Anya?
Yeah.
How was your tailbone from our last visit?
Not hurting.
Not hurting, right? So today we're just doing a tune-up, and we need to tune up the ankles and the knees today, okay? Good. Mid-back is nice and clear. Now, typically we're not going to get readings in the sacrum, typically in the adult. In the child, because they're individual segments still, it does show up as nerve pressure. Not always, but it can. So in her case, we have just a tiny bit of about 5 points, 7 points right there. Okay. So you want the good news, Anya?
No.
We only got a little bit from where it was last week. There's only like 7 points there. So I think after today's visit, she'll be good for a while again, okay? Now, in Anya's case, she maintains her tune-ups, right? In her spine and her body. Why? High competitive. She's not gonna hold back in her dance. She goes for it. And she's not scared. That's the beauty. She has no fear. And now she knows if something goes out, where do you come? If something hurts, or if your tailbone hurts, or your knee, or your ankle, what do? What do you tell mom or grandma?
Can I go to the doctor?
That's cool. You feel that one right there, Anya?
Yes.
Yeah.
That hurt.
That's the 4th cervical. We're going to adjust your 4th cervical, okay? We're going to adjust it. We're going to adjust the bone. Or
So you're gonna crack it?
I'm going to crack it, exactly. So you have to meet the patient where they're at. We don't like the word crack, but you know what? That's how she knows it. And that's okay.
It's called adjust.
It's called an adjustment.
Like I just on my knees?
Yes, exactly. And the cracking sound, or sounds like crack, is just gas coming out of the joint. Okay, can I have you relax your shoulders, please? You can close your eyes if you want. There we go. A light one, okay? Easy. There we go. Good. That's it. Beautiful. Hold on. Let's walk it off. Now, the other thing with Anya, we've tried many different tables to adjust her tailbone. She's very, very flexible, so it's a little more challenging on the side posture, but we're still able to get it. Knee chest, she's also good at, but we find that you do best on this table, right?
Mm-hmm.
The orange one. You like the orange one? Cool. Let's go on the orange table. And we're going to be right on the 1, 2. Right there? Yep. Right there. I got you the whole way, okay?
Okay.
Let's just feel. There you go. Good stuff. You got her there? That's a little one.
What? That seems like a big one.
Little one. There you go. That's the rest. And the neck is now all clear.
0?
0. See, she knows she wants to be a 0 when she leaves here, right? Now the big test is going to be, let's see how this feels. Make sure we got all of it. Pretty cool.
Yeah?
Any pain?
No.
No pain. Okay. Go ahead and let's do a back bend. Pretty flexible. And no pain? Beautiful. Back over here. Now, I'm going to work on her shoulders.
Well?
Your shoulders.
Wait,
Easy.
What do you want? Oh, this.
Just that. And that. Now let's go on your back. Let's just feel.
Ow.
It's a lot less though than before. This one hurts more.
They both do.
They both hurt. Okay. We're going to do posterior fibula. Sound is the board.
I know that.
AS talus, medial tilt. There. Excellent. Posterior fib. Good. AS talus, medial tilt. There you
What
go.
does the board do?
The board absorbs the force, so I'm able to go quicker on the adjustment,
Oh.
and it doesn't, you don't feel it as much in terms, it doesn't hurt when I do it, right? So the idea, it's really to go quicker on the adjustment and to absorb the force so you don't feel the pain.
What?
Okay? Posterior EX tibia. You okay there?
Yeah.
There. Perfect. Posterior EX tibia. There you go. Let's walk it off, please. Jump. Jump up, jump down. Make sure your ankles, knees, and back don't hurt when you jump. No pain, right? Posterior ulna. One more.
Anya.
She's good. We're just gapping the joints. You do handstands also?
Yeah?
She does all that, right?
No, not really
You
anymore.
walk on your hands too?
Not really anymore. I used to.
Squeeze. Squeeze. And we forgot the ear. You fly higher when we do the ear. Turn this way.
What does that do?
That adjusts the inner, inside the ear. You have 3 little bones. It's called the incus, malleus, and stapes. That helps balance
Oh.
and your hearing. So for you, you jump a lot, you twirl a lot. It helps with your balance. Easy. That's all.
Owie.
Good stuff. Now, we did a lot of work with Anya over the past several months, and the main reason she originally came for was the sacrum because of her back bends, right? And we found an S3 nerve pressure. We've been working on that. She's been doing well. And then, you know, she's high competitive, high energy, and we just make sure we keep everything in line. What's cool with Anya is she knows when she needs to get checked, right, Anya?
Mhm.
You know when things are out. That's really cool. I don't have to tell her when to come in. I don't have to tell you either. She knows her body.
Because I'm off.
So we're getting pressure down S3. We're getting pressure around T9, T10. And I'm also working on this 4th cervical for her. And I don't know if you remember on the x-rays.
I remember.
C4 is something I want to work on. Whatever's happened in all this dance. When we look at C4, it's tilting back quite a bit, and we got most of it, but there's still a little bit there. So C4 we're going to look at closer. T9, T10 area, and the sacrum. Let's go ahead and statically palpate. You can see it changes right there. It hurts a little bit right there. Now, does it hurt more when I push here or here?
There.
Okay. How about that one or that one?
The last one.
Yeah. And that's where we're actually getting the break. Okay. So what happens is in the thoracic spine, we know that the nerve is here, but the actual contact is here. The vertebrae is a little bit bigger there in that area. So let's count again. Head down, please. That's 9. That's 8. It's right there. Anya?
Which one's the worst?
This one.
Yeah. Okay. 7. Let's look at the sacrum. So just looking at the dimples here where my thumbs are, they are even. Okay. We're going to just test the motion of the sacroiliac joint. Top of the joint, middle of the joint, bottom of the joint.
Bottom.
Pain?
Yes.
Okay, scoot back please. Top of the joint, middle of the joint, bottom of the joint. Moving well, right?
All of them really hurt, except the
No
last
pain.
one.
No pain there, right? No pain in there.
No.
Okay, now, so we're getting tenderness at the bottom part of the SI joint, but we are also getting a pressure reading in the sacrum. Now, what'll be interesting is if it's that S3, S4 towards that right side. Let's see. So that's S1, S2, 3, 4. Which one hurts most? 4?
I think.
Yeah. All right. I'll relax. 3, 4. So it's 4, S4, slightly off to the right. And I can feel the difference. It's very tight here. This side feels good here. So we're going to set S4, we're going to set T7, and we're going to set C4. So let's go ahead and set your neck first, okay? That's 2, that's 3, that's the one right there. All right, let's go ahead and set that C4. Nice and light, okay? Nice and light. There it is. Look up. There. Gotcha. Cool. 7, 6, T7. I'm going to set it really light as a PL. Easy. Nice. S1, S2, S3, S4. There we go. Bring the knees back a little bit more. There it is. My knee is going to be right there on your back there. Tummy down. Down. Nope, down. Down. Down all the way. Bring your chin up. There it is. Gotcha. That's it. Come on up. Walk it off. That's it. Have a seat. Let's recheck it. I have a feeling we're going to need to do the pelvis still. Back towards me. S1, S2, S3. Doesn't hurt, right? Top of the joint, middle of the joint. Doesn't hurt. Good. We got it. It just didn't make the huge audible like last
Better?
time. Do a back bend just to test it out. Hold on. Let's close you up here. Test out the back bend.
For the doctor.
Bueno? Come on back. Let's recheck. Mid back's clear, down low is clear. Just want to make sure here. Yeah, it's clear. Make sure she does some icing today, okay, on that low back. We went after it a lot today. Let me check the neck now. Head down. All clear.
This do.
This for the shoulders. You use your hands and shoulder a lot, right? Okay, let's go on your back. So let's first test the knees, make sure the tracking is good. Tracking is good. Let's do valgus varus stress. Hurts? Relax. Relax. Pretty good. Tiny bit on the back side. Let's go here. A little bit on the tibia there. Valgus varus stress. This one's more here. Okay. Tracking. You need to set the tibias. Tibias and the talus, both of them. Okay, let's go ahead and use the board. We're going to set the talus, ankle, down. Sound is the board, okay? It's not her. There you go. Talus. Good. Toes are good. Toes are good. Bend the knee. And relax the ankle right there. We're just setting a straight posterior tib. There you go. Posterior tib. There you go. Walk it off. See how that goes.
How does that feel?
Walk up on your toes, up high,
Wait, how?
Relevant.
Yep.
Go like this.
however you want. On your heels. Stand up here on the table.
Wait.
Yep, stand up. And then jump down. And then tell me how that feels on your knees and your ankles. Do it again. Again.
She could do it like,
It hurts
like
right
a lot
here.
on the trampoline.
Where? On the arches? Okay, both of them or just the right?
Both of them.
Okay, go back on your back. So when you land, it's hurting here?
And on my toes.
On the toes also? Okay. Let's get a little more of the talus. There. Can you relax the foot?
Relax the foot.
You got her?
Yeah.
There it is. This side now? Just needed a little more.
Slippery.
There you go. Try it again. Do
Both
it
are
again. Do it again.
Does one hurt more than the other? Which one?
Okay, go on your right side. Let's set the arches. Calcaneus. Other side. Calcaneus. Navicular. Face down. Coming off the third ray, we're going to get to the middle or second cuneiform. How's that feel, Anya? Ah! Nikita, it looks worse than it is. Okay. Coming off the third ray, same thing.
Yes.
There you go. Okay, walk it off first. Up on your toes. Does that feel different when you walk on your toes? Okay, stand up on the table. Jump down. Do it again. You can't I want you to land on your feet though. Don't fall. Which one hurts more?
Say the truth. Which one hurts more?
Sure?
Ay, mas suka din ito.
Ikaw ko.
Oh, no? Okay.
Tell me what's going on today.
What?
What's hurting?
Table.
Tailbone's hurting? What about the neck?
Nope.
What about the mid back? Tailbone, knees, and ankles. Got it. Okay. So let's get you all tuned up. I hear you have a competition, or?
Yeah, her first of the year, January 12th.
Very nice.
What I think.
What kind of competition is it?
It's a dance.
Dance?
Yeah.
Contemporary?
Contemporary.
Has she ever complained after a visit here, like
No,
a couple hours?
she always leaves feeling better than she came.
Cool.
Listen, when we started coming, she couldn't feel her legs when she danced did floor work.
Say that again?
When we started coming, like a year ago, when we started coming was because something what happened with her back, and when she did floor work on the floor, she was complaining she couldn't feel her legs all the time.
Because they were numb?
Yeah.
Yeah.
She would say they were numb. And that was the main thing why we got freaked out and started coming. She was a 7-year-old with numb legs dancing. That's not really the best thing.
And since we've been working with her?
She's never had that problem again. After I think 2 months.
Very nice. Now, what's really cool today, she's complaining of the tailbone, and that's really all we're finding. So whatever's going on, there's nothing going on in the rest of her spine.
She's also gotten really in tune with her body. Like, she knows what's off when it's crazy.
And she's changed a lot of her training, I hear.
Yeah.
A lot more fluid.
And
so
now
I
she has
asked.
speech pads when she trains, which was never allowed before.
So can I share something with
Sure.
you? I asked Olga what the difference was with her since yeah. And I asked her, what's the difference since she started with you, right? Since she's been working. She says she's become more fluid this past year, which is kind of cool, I think.
No, it's especially for the style that she wants to pursue contemporary.
Which is contemporary.
That's the goal.
So I think what we should do, we're going to do it on the knee chest table. Yes? This one? And then we will do the knees and the feet. How's that sound? Let's do it. There we go. And we're doing S3. Tummy all the way down. Okay. I'm going to put my knee right here on the glute so when I push through, this doesn't move around. You all good there, Anya?
Mm-hmm.
Can you bring your knees back a little more? Thank you. Now, all the way down. Good. Good. Home run. Smooth like butter. Right?
Mm-hmm.
Uh-huh.
Her bunions are getting really bad. Do you see?
Yeah, we gotta work. It's coming from her ankles. We need to work on those ankles a little bit more. One thing she may want to do also to consider when she's going hard, she may want to tape the ankles.
Not going hard by mean every day.
No.
So how do we? No. I mean, they
They
train
go hard
Olympic
every day.
style 4 times a week. Monday, Tuesday, Thursday, Friday, 4 hours straight.
What I'm gonna do is after this competition and I get back, I'm gonna go over some taping stuff with you, and I have elasticon. I'll get some extra for you, and I'm gonna teach you how to tape her, just to be safe. And it's an elasticon. It's very light. It's not going to affect her performance, but I'd like her to train a couple of days with tape.
That's fine.
Okay. Good. Good. Yes. 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 Now time for your knees and your feet.
Wasn't the board.
It was the board, right? Cool. Relax. Ankle, talus. There you go. Nothing hurts when we're adjusting, hopefully. AIM femur, posterior tib, posterior fib. Sit up for me, please. Let's check the shoulders.
Just to walk around with the shoulders forward.
What are we?
Yeah, what happened here? I gotta set it for you, okay? Nice and easy. Go back on your back, please.
The what?
Okay. Let's just check the motion. And you haven't had any hip issues, right? No hip issues this year.
I know. I mean, Olga says she lacks hip mobility. That's the only issue. She says she's not flexible enough in her hips.
Okay. Well, we're gonna work on that in the new year.
They crack? No,
They crack all the time whenever she does anything. That's bad.
Like when they do.
Like they just cracked one.
We need to sort that out. Let's work on this. Go on your side, please. Okay, so.
Anya, puszczam się opacinką, że się puszczaj.
This is for the bunion, okay? Nice. This one's gonna feel good. Nya, 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 nya. That's the bunion. And I gotta fix this. If I don't fix that little bone, sesamoid bone, it's not gonna hold. Breathe,
To na palcach można zobaczyć.
breathe. Relax. There you go. Nice. Okay. Come up. Walk it off. I know Anya, it's not fun. I know it's not fun. But we gotta do that one for your bunion, okay? Otherwise, guess what happens? It's gonna start going to the side, it's gonna be harder to be on your toes, okay? And that's the worst of it. You okay?
It's already like this one, how it goes to the side. See?
Yeah, so we're gonna need to, and that's a lot from the ankles. So one of the things I was talking about is we probably wanna tape the ankles, light tape,
That's fine.
and you can use the spacer temporarily while we're fixing it. Okay? Are you mad at me? No! It was a little uncomfortable, right? But how does it feel now? Can you walk on your heels? Up on your toes? You taking first or what? You gonna get first place?